A very good morning, ladies and gentlemen, and welcome to yet another CEPD program organized by Shri. Right. So today's topic is something that you would be commonly seeing in your day-to-day practices. It's about the common overuse injuries in swimming. And today's lecture will be delivered by Dr. Irshad Jabbar. Dr. Jabbar is a graduate of the University of Sri Jayawardhanapura. After his MBBS, he has completed a postgraduate diploma in sports medicine at the Postgraduate Institute of University of Colombo, followed by an MD in sports and exercise medicine in University of Colombo. He's currently working as an acting consultant in sports and exercise medicine at the Colombo South Teaching Hospital, Colombo Villa. He has over 13 years of experience in the fields of sports and exercise medicine, and he's the current treasurer of Sri Lanka Sports Medicine Association. So, without further ado, Dr. Isa Jabra, welcome to the session, and over to you, sir.
Good morning, everybody. Thank you very much, Dr. Shakti Senaratna, for your kind introduction about me. And also, I want to extend my heartfelt thanks to the Shri organization. And today the topic is common overused injuries in swimming. So, when you say it's overused injury, that is we have like mainly the overused injury in swimming more than the acute injuries. So these are the topics we will be dealing with. uh, a small introduction about swimming, and without the basic biomechanic of swimming we won't be able to diagnose the disease early and treat early, and predisposing factors of overused injuries in swimming, and principles of treatment of overuse injuries. And of course, you should know your basic anatomy that we were studying from the beginning of our medical school. That is a musculoskeletal system. Without having a knowledge in musculoskeletal system, you won't be able to diagnose sports-related musculoskeletal injuries. Then we will be discussing the common overuse injuries. There are so many overuse injuries. We won't be able to cover all these overuse injuries in 1 hour. So I have selected main 4 overuse injuries. Those are swimmer's shoulder and swimmer's back, swimmer's knee, and swimmer's neck. And finally, we will be like having some slides in types of strokes in swimming. There are 4 main types of strokes in swimming. That is swimming styles. So that also I will give a small introduction on that. So swimming is a unique sport. Why? It is a full body workout. It combines the upper and lower limb with strengthening exercises and the cardiovascular training, especially in a non-weight bearing environment. Most of the sports, all the other sports are done in the weight bearing environment, but swimming is in a non-weight bearing environment. But still, the swimmers are more prone to have injuries. So the other thing is, as we all know, swimmers begin their career earlier than many other athletes. Now, normally, other sports, the children, they start doing multiple sports when they are very young in school days. But when you come to swimming, most of the children, they start only swimming when they are very young. So they will be doing swimming for a long time in their lifetime. That was one reason for overused injuries. And when we take international, that is elite elite swimmers, they may perform about 1.5 million, that is 15 lakh strikes per year. So like uh, it is like a huge amount. So most swimming injuries are classed as overuse injuries. And these overuse injuries are related to faulty biomechanics. So without knowing at least the basic biomechanics, it is very difficult to diagnose and treat the injuries in swimming or injuries in any sports. So the most common swimming injury regions are that today we are going to discuss them: shoulder, neck, lower back, and knee. So swimming excellent form of is an excellent form of full body workout exercise or sport. So where all your musculoskeletal system, that is your muscles and joints involved. So this is good for recreational swimmers and for competitive players. So these are the common or usually listed swimming overuse injury reasons or the causes for overuse injuries in swimming. So the first one is poor stroke mechanics and poor breathing techniques. So there is a breathing technique in swimming. So you have to alternatively turn your head and breathe. And poor flexibility or range of motions of the neck or lower back. So that is uh, very much needed, the movement of the neck and the back when you swim. So it has to be at its maximum flexibility and range of motion. Then hyper flexibility of joints with insufficient muscular stabilizations. So there are some disease, they have some hypermobile joints, and hypermobile joints also not good for swimming if you have the range of movement in the extreme, because it the joints may dislocate when it is very hypermobile, or it may subluxate. Then the decreased rotator cuff or scapular muscle strength, that you all know the upper limb is connected to the chest or thoracic wall through the muscles of some muscles, rotator cuff muscles, and the scapula is connected to the thorax with periscapular muscles. So strengthening of those muscles are very important. Then for like in each and every sports, in the core strength or the strength is stability of the core, that is pelvic, abdomen, and chest muscles should be very like strength, because the limbs are connected to the trunk. So from the trunk only, it has to generate the energy. Then decreased hip muscle strength, that is now the lower limbs are connected to the trunk through hip muscles. So there must be a good like strength of the muscles which are connecting the lower limb to the body. Then of course overtraining. So when you overtrain the athlete, they are more prone to get overused injuries. And insufficient rest period. So recovery in sports is very important. So if we don't have enough recovery, there's a high chance of getting overuse of injuries. So these are the principles of treatment in overused uh, injuries. So as in all medical diseases, we have to treat the cause, and there are some specific additional elements in sports. So we have to modify the activities of the athlete. So these things are actually customized things, and to, patient athlete to athlete it differs, and specific therapeutic exercises to promote tissue repair. So when you rest the injured part, so it may lose the muscles, or the area may use the strength, power, and bulk of the muscles if you just rest. So we normally in sports, in the field of sports and exercise medicine, we don't rest the muscles which is injured, and then and there first day itself we start doing therapeutic exercises within the limit of the pain. Then, of course, to increase the healing process, we do some soft tissue therapies, right? So there are you can use manual therapy, and there are machines to use soft tissue therapy. So like that, we can do some soft tissue therapies. So at the bottom of the management principle, the pharmacological agents, where which is appropriate. So in our field, sports and exercise medicine, we don't give a priority to the medication, so tablets or something. So we start with therapies. So that is exercise therapy that is very important in the field of sports and exercise medicine. So today I will be talking about this swimming. The mainly there are four types of swimming. So whenever I say swimming, that indicates that I am mentioning the freestyle, free stroke swimming. So there are phases in swimming. So these are the four main phases. Hand entry. There you can see on the right side there are pictures. That is, you can see from the lateral side and from the anterior side, like you see in the X-ray. So the hand entry, how it enters into the water, and the second phase is reach or glide. So where you glide into the water and pull through. The third phase is pull through. So you have to pull through the water for propulsion. Then finally a recovery. So out of these all four phases, there you can see in 1, 2, and 3, the hand is inside the water. Only in recovery, the hand is off the water, outside of the water. So to if you want to swim faster, you have to be more in the water, not in the hands should be in the water, not in the air. So now we will see the basic biomechanics of swimming. Biomechanics is actually very complicated. So I have made it very easy for you all to understand, because the word biomechanics we don't normally in other field except orthopedics, and other people don't use the word biomechanics. So basic biomechanics of all sports. All sports have their own biomechanics. So it's better to understand yeah, the basics of biomechanics when we treat injuries in swimming. An understanding of swimming biomechanics and typical injury swim aids in the early recognition of injury. So as in all medical diseases, early recognition is very important. So if we know the basic biomechanics, then when the patient says the history, so mechanism of injury is very important in the field of sports and exercise medicine. It is now if we listen to the athlete very carefully, we can diagnose only from the history more than about 70-80% of the cases. The initial treatment, then the design of optimal prevention, and rehabilitation strategies. So rehabilitation strategies, we have standard protocols, and we have customized protocols also. Then swimmers, you all know swimmers use both the limbs, upper limb and the lower limb, and the arm or the upper limb generate approximately 80 to 90 percentage of the propulsion in swimmers. So upper limb is very important in swimming. So swimmers try to generate propulsive force while reducing the resistance to forward motion. So there are so many forces acting on the swimmer when they are in the water. So there are some forces it resist their swimming. So swimmers always try to generate propulsive force while reducing the resistance to forward motion. So there are some strategies we will be discussing later in slides, right? So now we will see the forces acting on a swimmer, right? The primary forces acting on a swimmer are drag force, lift, and gravity and buoyancy. So you could have heard these words. So these are the forces acting on a swimmer. So lift and drag in particular are crucial for propulsion, that is for forward movement. So lift force and the drag force are very important for propulsion of the body in the water. So now we will see one by one the forces acting on a swimmer. The gravity, you all know, the gravity always try to pull the swimmer downwards towards the bottom of the ground or pool. So its magnitude is determined by the swimmer's mass and the gravitational acceleration. So these two things are very important in gravity force. The other one is buoyancy, that is opposite of gravity. So buoyancy, like this is the upward force exerted by the water on the swimmer's body. So this is the opposite of gravity, or it counteracts the gravity force. If buoyancy is greater than gravity, what will happen? The swimmer will float. If gravity is greater, swimmer will sink. If there is no active propulsion. Then the other force is lift force. So lift force is always acting perpendicular to the swimmer. So lift is also important in swimming. Swimmers generate lift through their arm and leg movements. So they generate lift of their body in the water by using or by moving their arm and leg in the water. So there are some tricky ways to increase these things. So by angling their hands and feet, they create pressure difference that propel them forward. So in front of the head of the swimmers, in front of the head, there will be a vacuum created when they swim, and there will be low pressure, and so the swimmer will automatically move forward. So he will be propulsed. So there are some tricky ways. So when you put the hand and how to enter the hand into the water and how to move the feet, all are very important in swimming. And I will be showing some slides how to do those things. So it is a reaction force essential for propulsion, that is lift force. So this is propulsion in swimming. There in the first diagram, you can see the black one like comma shape. It is that is the swimmer. Then the blue color one, the upper layer of the water above the body of the swimmer, and underneath you can see the red color line that is the under the swimmer, that is the lower streamline. So there you can see the lift force is always acting perpendicular to the swimmer, and there you can see above the swimmer uh, low pressure and high velocity, and below high pressure and low velocity. In the second picture, you can see the hand is in an angle. We call it angle of attack in swimming. So when you touch the water in this angle, about 45-degree, you can increase the lift force and reduce the drag force and propel your body faster than when you keep your hand in a perpendicular way. So the angle of attack at the 45 degrees is very important, right, to propel the body faster in the water. The other one is drag force. Drag force, there are three types of drag forces. So the one is foam drag or pressure drag. The other one is surface drag, wave drag. So this drag is the resistive force. So this is the force which resists the swimmer to propel. So this is the resistive force that opposes the swimmer's motion through water. So we always, the swimmer have to try to reduce the drag force to swim faster. So this is one of the significant factor affecting the speed in swimming. So when we see the first type of drag force, that is foam drag, this depends on the shape of the swimmer's body and the water pressure difference around the body. So when you double the speed in water, you quadruple the form of drag force. So form drag force, you are quadrupling. So when you increase the speed, there will be more resistant by the water. Then other one is a streamlined body. Now you all could have seen the swimmers when they swim, they make the body straight and keep the hands straight in front of their head. The whole this thing is extended, elbow joint is extended. That is called streamlined body, long and lean body position aligned with the direction of travel. So this position, we call it streamlined position, which minimizes form drag and propel the swimmer faster. So, and they will swim very efficiently in a hydrodynamical environment. The second drag force is called surface drag or friction drag. So there is a friction in our body and which always resists the propulsion. So this is caused by the friction between the swimmer's skin and the water. So there is one trick the swimmers do. They shave the whole body and it reduces the friction drag and they can swim faster. The last one is wave drag. This occurs when the swimmer's motion creates waves, dissipating energy and slowing them down. So when the swimmer now, you know the swimming and swimmers normally swim in the surface of the water. Divers, they dive under the water. So normally diving is faster than swimming. Diving is normally faster than swimming. The reason is they they uh, they avoid the wave drag when they are diving. So the wave drag is more significant at higher speeds and closer to the water surface. So when you are swimming close to the water surface, the wave drag also acting on you to reduce the speed of swimming. So now, how these swimmers use these forces. So now, if they want to swim very efficiently, they have some strategies to swim faster. So swimmers manipulate these forces to move through the water efficiently. First one is reducing the drag force. So in the previous slides, we saw drag force is a resistant force for swimming. So streamlining the body. First one, what I told earlier, you have to keep this body straight and both upper limbs in front of the head, the elbow in fully extended position. Then you have to minimize the surface area. That is also one strategy to reduce the drag force. Then wearing specialized swimming suits. You all know the swimming suits are very tight and there is no space between the body and the cloth. So that also one strategy to increase the speed of swimming. And maintaining a horizontal body position are all methods to reduce the drag. So always you have to maintain the horizontal body position, right, without bending here and there. So it has to be like one line, the body, then you can swim faster. So then the second one is minimizing the propulsion, maximizing the propulsion. So how to maximize the propulsion? So we must use their arms and legs to create propulsive forces. So mainly the arms are used for the propulsion. That is 80 to 90% in freestyle swimming. So hand and foot movements generate lift, pushing the swimmer forward. So hand and foot movements generate lift. So there's a force acting on swimmers that is called lift force. So we to increase lift force, we use the hand and foot in the water. So these movement also influence drag. However, effective technique maximizes forward propulsion while minimizing resistive drag. So you have to always think how to minimize resistive drag and increase the other propulsion forces. Then, in summary, swimming is a constant battle against drag while simultaneously controlling lift and buoyancy for propulsion and support, respectively. against the constant downward pull of gravity. So that is how the swimming is done. So a little bit of anatomy that we learned from our medical school. So I will just run through the muscles, name of the muscles. These are the muscles acting on a shoulder. So shoulder adduction is done by pec major, teres minor, and left dorsi. Then the internal rotation, pec major, teres major, and subscapularis deltoid. So adduction and internal rotation together. So both these movements, adduction and internal rotation together, is called the pull-through phase of swimming. Abduction, deltoid, supraspinatus, trapezius, and serratus anterior. External rotation of the shoulder joint is done by infraspinatus and teres minor. So abduction and external rotation is called the a recovery phase. So there are four phases we saw in the early slides. So this recovery phase is the last phase of swimming. Then flexion, which is done by pectoralis pec major and deltoid. Extension of the shoulder deltoid, that is mainly the posterior deltoid, and teres major and subscapularis. Protraction of the scapula, pectoralis minor and serratus anterior, retraction of the scapula rhomboids major and minor. Why I have inserted this slide is now you have to know your basic anatomy. So I told you earlier, without knowing your basic this musculoskeletal anatomy, you won't be able to diagnose the musculoskeletal injuries. So the next one is muscles involved in the elbow joint, flexion by biceps brachialis and coracobrachialis, you all know. Then the extension is by the triceps. Then pronation, pronator teres and pronator quadratus. In the wrist, flexion is done by long flexors of the forearm, and extension, long extensions of the forearm, abduction, flexor carpi radialis, and adduction, flexor carpi ulnaris. Then in the hand, palm introsai, adduction of fingers, lumbricals. This doesn't have a bony attachment. That is to balance the long flexors and extensors of forearm. Adductor pollicis that adduct the thumb. Then thorax, intercostalis and diaphragm, abdomen, oblique muscles, and neck, sternocleidomastoid. These are the important muscles. I didn't include all the muscles, right? Then spine, that is very important. Erector spine muscle group, iliocostalis, longissimus, and spinalis. Semispinalis group, transversospinalis, and multifibrilars and rotators. Then short segmental muscles, levator costrum and intertransversi and interspinalis. So, right. Then in the lower limb, hip flexion is done by iliopsoas and rectus femoris, mainly iliopsoas. Extension by glute maximus, hamstring muscles. Adduction, adductor group of muscles. Knee joint extension by quadriceps, ankle joint flexion by gastrocnemius soleus, long flexors of toes. The toes flexion, flexor hallucis, and flexor digitorum muscles. So these are just to list the muscles which are acting on joints. Now we will enter into the topic proper, that is the overused injuries, common overused injuries in swimming. So the first one and the commonest one is swimmer's shoulder. So this swimmer's shoulder was introduced by Kennedy and Hawkins. These are a group of pain-producing conditions in shoulder. So the most common injury in swimmers, this is about 40%, right, in swimmers. So swimmers shoulder is 1/3 of the swimming problem is related to shoulder. So in elite athletes, it is as high as 91%. So you can appreciate how common this shoulder injuries in international players. Then rotator cuff tendinopathy is the most common one. And out of this, you all know the rotator cuff muscle supraspinatus, infraspinatus, subscapularis, and teres minor. Out of these four muscles, supraspinatus tendinopathy is common of all, right? Then the frequent other causes are tendinopathy of the long head of biceps, impingement against the anterior third of the acromial arch. So there are some studies they have showed external rotation more than 100 degree or less than 90 degree at a greater risk of shoulder impingement syndrome. So this is a study. So like in this range of movement, right? The range of movement should be in a range. If it is more, so there is a higher chances of dislocating or subluxating the joint. If it is less, the joint is the range of motion is less, then the uh, uh, joint is stiff. Then we won't be able to perform well. So both are not good. There is a range. So the range of motion should be within that range. So these are the causes for uh, or risk for shoulder injuries. So after an abrupt increase of training volume or intensity, that is obvious. So if the training volume is very high, close to an event or competition, might lead to shoulder injuries. So with training volume more than 35 kilometers per week or 15 hours per week. So now, unlike other sports, you could have seen swimmers. Swimmers sometimes they train twice a day, twice a day, morning and evening. So if they train about more than 1 hour in a day, twice, and for 1 week they will be doing totally more than 15 hours per week. So this is also very important. So training volume is very important in shoulder injuries. And other one is when a unilateral breathing pattern is used. So as we all know, when they swim, they will alternatively turn their head side to side, right and left and right. They will turn their head. So unilateral breathing is not good. So they have to turn both side, right, alternatively and breathe. That is only good. Then after recent change of stroke technique. So when they change the stroke techniques, there might be a risk of shoulder injury. Then when crossing the midline with the hand during pull through. So the pull through, you all know pull through is the third phase of swimming. So when you pull through the water, right? So when you swim, there's a midline in your body. So that goes through the midline of your body. So that midline is now now when you put the right hand should not cross the midline and go to the left side, and at the same time left hand should not cross the midline and go to the right side. So when you cross the midline when you're swimming, if you cross the midline in pull through phase, that is also they also more prone to get shoulder injuries. So with the other one is past history of shoulder injuries or any disease. There's a past history. There's a high chance of getting it again or recurrence. So with the recent change in coach, so different coaches they have different techniques. So when they change the coach, very often the risk is high. Then after increased use of hand pedals. So when you use hand pedals, there will be high resistance or drag force. So if they use for a long time these hand pedals, they will give more load to the shoulder joints. When the load is increased, it may injure. And the last one is with the use of drag, increasing training devices, whatever the device which increase the drag, because drag force is acting against the propulsion. So it's a resistive force. So this is very important when we do examination of swimmers. So we see the patients, uh, whether the athlete swimmer can maintain a high elbow. So there you can see the athlete is seated on a examination bed, and he has abducted his upper limb. Then there's an internal rotation, right? He has internal rotated his shoulder with 90 degree of elbow flexion. So when you measure the angle, that is this one, when you measure the ankle here from along this body up to this, it has to be, the angle has to be 150 to 170 degrees, right? It has to be. So that is the angle we see. So that is called abduction and internal rotation test. So that is to have an idea about their high elbow. So they have to have high elbow. So this test gives important information about the swimmer's ability to achieve and maintain high elbow. Right? Then only they will be able to swim in the water. So less than 150 or more than 150 is like when they have this angle less than 150 or more than 170, they are more prone to get injuries, shoulder injuries. So internal rotation is the most important, as it allows the swimmer to have an early catch and high elbow. So this is very important in swimmers to perform well. The other test is important test. We call it combined elevation test. Here we do three things. One is thoracic extension, other one is shoulder elevation, next one is scapular retraction. So there you can see the combined elevation test is combined with three tests. So the combined elevation test, a test for thoracic extension, shoulder elevation, and scapular retraction. The swimmer lies in a prone position and in the bed, and his chest and hip and legs or foot all touching the bed, and he has to elevate the upper limb above the shoulder. So this angle, now we measure this angle from here to this horizontal line and the humerus angle. So the angle is measured to the horizontal line to the humerus elevation, and it has to be 5 to 15 degree. So the combined elevation test can give more information about the ability to achieve a high elbow position at the start of the stroke, recovery, and streamline. So this elevation is very important to the streamline to keep the body in lean in one line. Right. So these are the two tests we do. One is abduction with internal rotation to see whether they can maintain a high elbow. The other one is combined elevation test, a test for thoracic extension, shoulder elevation, and scapular retraction. So these are management principles of shoulder pain in swimmers. So always it is individualized rehabilitation programs, emphasizing. So we have to regain the range of motion, previous range of motion, and we have to have the flexibility of the muscles and joints and muscle balance and motor control of the glenohumeral, and at the same time scapulothoracic joints. As I mentioned earlier, periscapular muscles also very important in swimming. Another one is modification of training load. So we have to go through the history of the athlete, whether he is doing uh, high volume of training, and we have to adjust accordingly. Then correct the kinetic chain, focusing on both intrinsic and extrinsic factors. So in any sports injury, there are two main factors, uh, factors or causes for injuries. One is intrinsic factor that is related to the athlete. Other one is extrinsic factor. Extrinsic factor means the equipments, environment, all those things. So in swimming, we use a lot of they use sometimes a lot of devices to swim, and sometimes they use the environment, cold or hot, all affect the patient performance. Then there is something called kinetic chain, right? Kinetic chain. So now you, for example, you say now for a bowler in cricket, they need only the hand to bowl. But if they have some problem in the back or leg, they won't be able to perform well. They won't be able to do bowling well because there is some problem in the kinetic chain. So they need the whole body, the turning of the hip and ground force in the leg, all are needed for a best for performance. So same like that, here if the patient is having a back pain or issues in back or leg, it will affect their kinetic chain. So the so when we treat a sports injury, we have to uh, address all the kinetic chain. So in sports, in swimming, the kinetic chain means the whole body. We have to uh, address if there is a problem. Now say the patient is coming with pain in the shoulder, so we don't at the same time if he is having back pain, so we have to address the back pain also. So it will affect the kinetic chain. Then it is always like in other field, team approach. So we have to analyze their biomechanics, that is technical, stroke analysis, and we have to work with the coach. The coach, they are coach and trainers. They are the people. They teach them the sports-related specific techniques, and physiotherapists, of course, and doctors and sports scientists. The second most common overused injury in swimming is swimmer's back, mainly the lower back. So this swimmer's back, now I will be discussing the strokes in swimming. So there are main four types. So this is mainly common in butterfly and breaststroke swimmers. Butterfly and breaststroke swimmers, where they overextend or hyperextend their back, mainly the lumbar region. So body is positioned horizontally in the water. Gravity and buoyancy forces are traveling through the body with the potential to cause changes at the lumbar spine. So due to the undulating motion, that is mainly the hyperextension of the lumbar region utilized in butterfly and breaststroke, there is potential for developing pain secondary to stress on joints. So uh, the causes for back pain in swimmers, it differs. For young people, the cause is different from older people. So this is just to show you all how they hyperextend their back in butterfly and breaststroke. So hyperextension of the lumbar spine during freestyle and butterfly, and the other cause is for back pain, poor kick technique. The technique of kicking is poor, and stress fractures are potential cause in young swimmers. That's what I told. The causes are different according to the age. So when they are young, they are more prone to get stress fractures. Uh, they are the causes for back pain. So stress fractures mean they might have stress on facet joints. They might have stress on pars interarticularis. So those are the causes for back pain in young swimmers. But in all the swimmers, the disc degeneration and facet joint degeneration in the older swimmers, right? So they might have disc bulge and sciatica like symptoms and all. So some study shows excessive competitive swimming activities accelerate lumbar disc degeneration. So everything must be in a limit. So if you excessively compete in swimming, later in life, there's a high possibility of getting lumbar disc degeneration and disc bulge. This activity may exaggerate lumbar intervertebral disc degeneration, especially in L5 S1 intervertebral segment. Then other one is for back pain, the cause for overuse injury, improper timing of this butterfly stroke, increased strain on low back, possibility of neck, shoulder, and back pain. Then poor flexibility of the spine and low back. So that's why we advise all the sports athletes to do stretching and warm up before they start the sport. So always it is advisable to do warm up at least for 5 minutes and stretching, top to bottom stretching at least for 5 minutes to prevent or to reduce this or to minimize the injuries. So don't do the sports all of a sudden without doing these warm up and stretching. Insufficient core strength to maintain straight alignment of the body in water. So this is very important. Core strength. Core strength is very important in any sport. As I told you all earlier, core is your pelvic muscles, right? And the abdominal muscles, chest muscles. So that is the core of your body. So the core muscles should be very strength to perform in sports. So these, even though these limbs are connected to core, so if the limbs are like strength enough, the core is weak, you won't be able to perform well. So core is always very important. So in each and every sports injuries, whenever we address to the particular injury, we focus on the core strengthening exercises also. So core strengthening exercise is very important. So if the core strength is good only, you will be able to maintain the body alignment in the water in the horizontal manner. So in other sports, you are upright, you are in upright position. Here, it is your body is in the horizontal manner. So aggressive weight training using poor techniques. So we shouldn't allow the athletes to do out of the water aggressive weight training without any proper techniques. Then overuse of devices, as I told you all earlier, pedals on hands, fins, kickboards, all will increase the drag force, that is the force resisting your propulsion when you are swimming. Then tightness in the hip flexors or inadequate body roll during swimming may lead to compensation at the lumbar spine. So what is this? Now, if you don't have an adequate body rolling, right, or the flexibility of the muscles in the hip, what will happen? The back muscles, right, especially the lumbar region, has to work more to compensate those weakness. Then there will be more strain on the lumbar region and you will get low back pain. Then we will go to management of swimmer's back. So a thorough assessment of mobility of the spine and hips, pelvis, and are essential. So correction of muscle imbalances such as tight hip flexors, weak gluteus muscles, and core muscles, right? Then optimization of pelvic and joint mobility both in static, right, and dynamic status. Then practicing correct stroke technique with the guidance of a coach. So coaches must be scientifically trained coaches because in our field we don't involve in this technique correction and all. in the ground. So they are only the coach or trainer will tell us how the athlete is doing, right? So they have to correct their technique and things. And there are exercises to stabilize uh, spinal muscles. So that those are mainly the low back muscle strengthening exercises. So we normally in chronic back pain, we give low back muscle strengthening exercises. Then we have to tell the patient to avoid sudden increase in training volume and overuse of devices in swimming. So in some complaint or some conditions, we have to be little bit alert if a swimmer develops new low back pain that persists and the swimmer is without a history of or past history of low back pain, further investigation may be needed. So when they come with a new complaint, so you have to be a little bit alert, especially in young patients. They might have stress fractures also. If a spondylosis occurs, the swimmer may need a longer duration of modified activity. So it might go up to 6 months of rehabilitation. And we have to do at the same time co-stabilization training. Then the third overused injury in swimming, the common injuries in swimming is swimmer's knee. So there you can see I have in the picture, uh, I have circled the patella and the medial retinaculum and articular capsules in the medial side and the medial collateral ligament. So these are the four main structures which can get affected in swimming, especially in the breaststroke styles, right? So when we say swimmer's knee, that is most of the time medial knee. So swimmer's knee is highest in breaststrokers. I will show you the picture, then you will appreciate how it happens. The medial knee is the most common complaint from the swimmers. Then the repetitive stress is placed on the medial knee, produces pain during the whiplash motion. So in a breaststroke, right? In breaststroke, they swim like a frog, right? They swim like a frog. So they use their leg like deviated from the midline of the body, the knee and the foot. So there is a high chance of stress on the medial aspect of the knee, that is mainly the medial collateral ligament. So the breaststroke kick is a high valgus load produced during sudden flexion, extension, adduction, and external rotation of the knee against the hydrodynamic environment, resulting in stress to the medial compartment. So there is more strain at MCL compared to LCL or lateral aspect of the knee. So when they have more stress on the medial side, not only the MCL, at the same time, it may affect the medial uh, side of the capsule or synovium or the uh, medial plica, the ligaments they are in the medial side. So all may get affected. So strain injuries may also present in the adductor muscles when they abduct. When they abduct the hip joint more than 30 degree, it may affect the adductor muscles like adductor magnus and brevis. So in this stroke, breaststroke, uh, sometimes patients may complain of groin pain. Groin pain. So when we examine the patients with the swimmer's knee, we have to address the groin area also to look for adductor tendinopathy. That is the commonest one. Then they might have a psoas muscle tendinopathy. So narrow knee whip-like motion is advocated to avoid groin injuries. So I will show some pictures. I have some slides to show. So narrow knee means you have to keep the knee as close as possible and do the breaststroke style. So the more you widen the knee, the more there's a chance of getting injured. So these are the factors increasing the valgus load in the knee. So valgus alignment of the lower limb. So if the foot is overpronated, there's a high chance of getting valgus knee. The second one is inadequate or asymmetrical hip internal rotation or tibial external rotation. This also will increase stress, right, strain on the medial aspect of the knee, and large abduction angle of the hips during the kick. That's what I told earlier. So when they abduct during the mainly the breaststroke kick, right? When they abduct more than 30 degrees, right, there's a high chance of getting stress on the medial side of the knee. So ineffective arm leg coordination may increase loads on a lower limb, that you all know, and sudden increase in amount of intensity or training, that's as usual. Then hip extension and ability to achieve core and pelvic stability. Then how to treat medial knee pain or the swimmer's knee. So treatment will focus on elimination of inflammation. There they might get synovitis, capsulitis, so medial collateral ligament inflammation. So we have to eliminate them. And rehabilitation should focus on intrinsic and extrinsic factors, as I told you all earlier, right? So there are some intrinsic causes and extrinsic causes, which causes the long-term medial knee pain. So you have to do some stabilization exercises for hypomobile joints, postural corrections if they have some any. Now, say, for instance, if they have pes planus or hyperpronated foot, so we have to correct it to reduce the knee pain. Then strengthening and flexibility exercises as usual. Then what we have to do, we have to tell them to reduce the load, the breaststroke training, and they can do mixed training. The other styles also, they can add other styles and do without doing only breaststroke. Then exercise which plays a valgus load should be avoided during land and weight training. So swimmers, they don't practice, or they don't do sports only in the swimming pool, and they do some uh, land training also to increase their flexibility, strength and things. So exercise which are given to them should reduce the valgus load. So other one is hip rotation, range of movement should be optimized. So range of motion should be optimized in hip rotation. So we have to give range of motion exercises to the hip also to reduce back pain. So these are some evidence that I have put. 200 to 400 meter breaststroke events increase the risk for knee overuse injuries more than other strokes or distance. So additionally, training for more than 4 times a week increases the risk twofold for knee and fourfold for shoulder overuse injuries. The, uh, the other study says, looking at competitive swimmers, interestingly reports that breaststroke swimmers are at significant risk of a groin injury. So, as I told you all earlier, breaststroke swimmers, when the breaststroke swimmers present with medial knee pain, we have to address to the groin also to see whether they have any groin injuries. The fourth overused injury in swimming is swimmer's neck. So neck pain is mainly seen in the old athlete It may be due to joint arthritic changes and disc degeneration without nerve root irritation. So we have to, here in all the athletes, we have to see their x-rays and see whether there is any uh, degenerative changes in the X-ray, and we have to see whether they have any radiculopathies, and we have to address all of them. If the nerve roots are irritated due to degenerative changes in the neck, shoulder complaints can arise. So arthritic change may limit neck rotation and making correct breathing patterns difficult. So correct breathing patterns, as I told you all earlier, they have to alternatively turn the neck side to side and breathe. So swimmers who unilaterally breathe are more prone to get neck pain. So looking forward rather than directly downward, these things. So they have to look forward rather than directly looking downward, and extending the head to too high when taking a breath increase the load on the neck and create pain. So there must be a like a neutral way of at looking forward. So hyperextension and looking down both are not good when they are swimming. So the management is same as early. Physical therapy is a crucial part of recovery from neck strain in swimmers. Uh, Through targeted neck strain exercises for swimmers, physical therapies can help patients regain strength and mobility while preventing future injuries. Same thing what I told earlier, right? So we have to address the muscles in the neck, stretching exercise for the neck muscles, and strengthening exercise for the neck muscles. And we have to look for any other causes which produce neck pain. The treatment usually start with a comprehensive assessment to determine the underlying cause of the neck strain. So these are a physical therapy what we do here, right? The key exercises may include stretching exercises, strengthening exercises, posture correction exercises, mobility drills, core strengthening. So there you can see, even though the patient is having neck pain, we address the core strengthening exercises. So core strengthening exercises is very important in all injuries, right? Core strengthening is very, they are only the energies generated. So core is very important in all sports, right? So when you have a very good core strengthening, right? Core strengthening, then it is very easy to uh, like teach you the techniques of sports. No? So then strengthening is very important. When you have a very strength body, then you have to learn only the techniques in sports. So stretching exercises focused on improving flexibility and reducing neck and upper back muscle tension. Then these stretching exercises can help relieve stiffness and improve range of motion, both of which are essential for swimmers who experience restricted movement. That you all know. Then the strengthening exercises, we have to target the weak muscles in the neck, shoulder, and upper back. And strengthening exercises can help prevent further strain by improving muscle support around the neck. So we always used to give this stretching, strengthening exercises for the muscles in the neck. Then the posture correction exercises. So this is designed to address poor swimming posture, especially during breathing techniques. So you have to teach them the breathing techniques also. The exercises help align the spine, shoulder, reducing the risk of strain caused by improper head positioning. Then there are some drills, mobility drills. So we have to give them exercise that increase joint mobility and fluid movement. So this is very important. So when you give range of movement, range of motion exercises, the fluid moves around the joint. So when the fluid moves around the joints, it takes normally now take for example the knee joint. When you do range of motion exercises in the knee joint, the synovial fluid moves around in the joint, right? And it gives the nutrition to the cartilage and all and the surrounding structures, so it will heal faster. When it without keeping at rest, you have to move the joint, but it should be pain free. So same thing applies to the neck also. So these drills help swimmers maintain smooth and efficient strokes. Then the core strengthening. Core strengthening is very important, right? Strengthening the core stabilizes uh, core muscles of the entire body, right? Including the neck. Then strong core helps swimmer maintain better body alignment in the water. I told you earlier. So if you want to keep the body in one straight line, your core has to be very strong. So core strengthening exercise is very important. So these exercises are part of comprehensive physical therapy. So when you are when we send to the physiotherapist, they will definitely teach them how to do core strengthening exercises. So now we have finished main overused injuries in swimming. Those are the common injuries. There are so many, we can't cover in 1 hour. So there are some types of strokes. I will just run through the slides. So you have to just know there are some strokes that related to some specific injuries. So these are the main styles or main strokes in swimming: freestyle, backstroke, butterfly, and breaststroke. So, so this is freestyle swimming. You all know. So three main things we have to consider here. One is inadequate body roll. So body, when you swim, body has to roll, right? There's a rhythm. So body has to roll. So if that doesn't roll inadequately, you will have strain somewhere, right? More strain somewhere, and it will cause overuse injury when you do for a long time. The other one is striving too much length in a stroke. That is overreaching. So when you swim, you should not try to overreach and put the hand into the water. So if you try to strive too much, then that is also one of the cause for injury. The other one is a line of pull through that crosses far beyond the midline. As I told you earlier, when you swim, you have to keep your right hand right to the midline, left hand left to the midline. So when you try to cross the midline, so when you try to cross the midline, there's a high chance of getting injured. So this is backstroke swimming. Backstroke swimming, there you can see the shoulder is in high, like more range of motion than the other styles, right? So more range of motion at shoulder joint than other strokes. So in this style stroke, you will have more shoulder injuries. So shoulder injuries are common in backstroke than the other styles. Then here also same like previous one, that freestyle stroke, inadequate body roll. So body rolling is very important in this. Body has to roll rhythmically. Then pull through while elbow is extended. So here you do pull through while the elbow is fully extended position. So you will have more strain on the medial collateral ligament of the elbow, and you might end up with, finally you might end up with medial elbow pain, right? Then here we use something called flutter kick. So when you are doing backstroke, right, you kick. That is called flutter kick. You kick with only the foot will move, and the swimmer will float in the water. So they might get more strain on the in the ankle, and finally they will end up with ankle strain injuries. Then the other one is butterfly style. There you can see the butterfly style, right? So they when they come up of above the water, they have to a continuous hyperextension of lumbar spine. There you can see they overbent on the back, and this is called butterfly back. That is in butterfly style. So they will have more strain on the lumbar region. So finally they might end up with chronic pain in the lumbar region. So that is called butterfly back. So there you can see entering the arms into the water too far outside the shoulder line. So normally when you do butterfly style swimming, you have to enter the arm at the level of shoulder, enter the arm into the water at the level of water. So if you try to go far, that will cause injuries. And if you try to go less, you can't perform well, right? So both are not good. So you have to enter the upper limb at the level of shoulder into the water. So entering the arms into the water too close also not good. Too far, too close, both are not good. In the last, this thing is a breaststroke. So in breaststroke, you can see they move like a frog, right? They move like a frog. There you can see they use the leg, the knee, and the feet are uh, like more away from the midline. So there's a high a valgus load at the medial side of the knee, and it may cause strain on the medial collateral ligament, right? And at the same time, they might have problem in the medial plica also. Then that is called medial plica syndrome. So I mean, in this breaststroke, the medial knee joint pain, the main causes, the main structures get affected is MCL, then medial pica, then they might end up with sometimes patellofemoral pain syndrome and synovitis or capsulitis. Then here you can see excessive hip abduction, right? Excessive hip abduction is performed in this stroke style, right? In this stroke, breaststroke. So it might pull the structures in the groin, like for example, adductor muscles. So they might end up with adductor tendinopathy. And also at the same time, excessive elbow extension is used in this stroke type, in this stroke. So they might have again, like what I said earlier, medial elbow pain. So so now you can appreciate in a breaststroke, right? The wider you keep your lower limb, there's a high chance of getting uh, injuries in the medial aspect of the knee. So how to prevent swimming injuries? Swimming injuries can be prevented by avoiding overuse and using proper techniques. So always you have to use the proper techniques. Techniques are taught by coaches and trainers. Then avoid overuse, right? So you have to work according to a timetable. Then appropriate body alignment in line with the head. That is streamline. What I told you earlier, streamline, appropriate body alignment in line with the head. And the entry, correct entry and arm position, right? And alternate side breathing, right? You have to alternately right, left. So you have to alternately breathe and don't do only one style. So mix up the styles and swim to minimize or reduce injuries with the different strokes, right? So these all can minimize overexertion injuries and pain. Then always, as I told you earlier, you always, right? You must do stretching and warm up sessions prior to swimming, right? And even after, right? That is called warm down. After swimming, you have to do a little bit of stretching, right? And there are so many range of movement exercises and all you have to do, right? So I don't know whether you all have any idea about stretching and warming up. So warm up is normally you do the same. Now you can do warm up even in the swimming pool. So because you do the same movements what you do in your sports in slow motion, that is called warm up. Stretching is common for all. That is top to bottom. You have to stretch your body, right? Then dry land or out of water strength training can also help stabilization and the endurance of arm, leg, and trunk. So not only in the swimming pool, you have to do out of the pool exercises also. In addition, for short-term relief, you can use anti-inflammatory Those things I don't have to explain. You all know that, right? Then it can be normal for swimmers to experience mild to moderate muscle soreness following a training. That is normal. Right? However, if one experiences any unusual pain or pain that doesn't improve over time, then you should reach out a sports medicine. They should reach out a sports medicine specialist for appropriate evaluation and treatment to prevent more serious injuries. So there we involved, right? So you'll have to refer the patient to sports and exercise medicine units. Now we have about 16 sports and exercise medicine units in Sri Lanka. So we are hoping to increase the number of units in future. Uh, right. So as conclusion, right, these are take-home messages. Swimming can be a great sport for recreational swimmers up to elite swimmers. So I don't know whether you all have idea about this recreational and elite. Recreational swimmers means they are doing swimming for hobby, right? Swimming is an excellent exercise for full body workout. Inadequate body roll, crossing the midline, and overreaching are the main reasons for overused injury. MCL sprain is common in breaststroke style. To maintain a streamlined position, core stability is important. So always address the stability of the core. Then swimmers need to transfer load efficiently between the arms and the leg under internally generated flexion torque. So always they have to have a very good core to efficiently transfer the energy from limbs to limbs. Then, as a doctor, we should help swimmers to overcome the injuries and liaise with physios, trainers, coaches, and parents with regard to children for the best results. So these are the reference I went through. Bruckner Khan's, that is the recommended book for our MD program in Sri Lanka. Then AASCM, that is American Association of Sports and Exercise Medicine. Other one is Physiopedia. So thank you very much.
Thank you, sir, for that very informative lecture. We do have a couple of questions coming in from the chat box. So we'll get through those first. And we have a few questions which have come up in the pre-registration forms. We'll try to get through a few of them as well. So the first question that has come up in the chat box is, sir, what does it mean by unilateral breathing pattern?
Yeah, that is unilateral breathing pattern is normally when we swim, you could have seen they turn the head side to side, right? Right and left, left and right, like that. So that when they swim, so if they like do turn the neck or head only in one side, that is called unilateral swim, unilateral pattern. So they have to alternatively do it.
Thank you, sir. And the second question is, a patient comes with sudden onset pain while practicing swimming for more than 2 hours.
Yeah.
What could be the reason for that?
Yeah, this can be an acute injury, either acute injury or acute on chronic injury, right? So we have to thoroughly examine the patient. There are so many reasons. Acute, where pain, acute severe.
That's not specified, sir.
Yeah, that's what. So it has to be either a new injury or that is an acute injury, or else acute on chronic, right? Acute on chronic injury. So this is not overuse injury, because overuse injuries normally, it comes gradually, doesn't come all of a sudden.
Right. I think that answers another question as well, because in our pre-registration form, I think a couple of people have asked, how can a primary care physician differentiate between overuse injuries and acute trauma in swimmers?
Yeah, it's very good. Now, overuse injury, you have to go through the history, right? Then they will say. But in other field, there's a duration for chronic injury, right? So now, say in other fields, say in orthopedics. So if when we label injury is chronic, so it has to be more than 6 weeks or 6 months, right? That depends on the condition. But here you can get overuse injury in days, in weeks, in months, right? So that depends. So here there is no time limitation for overuse injury. They are chronic injury, they have a time limitation. Here we don't have, we don't use time limitation. So it can be in 1 or 2 days also, right? So normally overuse injuries happens when the athlete is having an event ahead, right? And a competition ahead. So they will have, they will overuse these things, but our body also like a machine, right? You can't overuse it whenever you like. So yeah, there must be some recovery also. So they will have injury. So overused injury, actually we have to go through the history.
Okay, so, another question which has come up several times is what are the early signs that could be used to identify an overuse injury at a primary care setting? Seems to
Early,
be early signs and symptoms which can be used to identify an overuse injury in a
yeah,
primary care
this,
setting.
yeah, the symptoms you have to ask from the athlete whether he has increased the volume or load of practice very recently, that you have to ask, right? Another thing is whether it is gradual or sudden onset, right? So those are the two main things you have to ask. And normally in our field, we know when they are starting to tell the things, we know this is an overuse injury, right?
Uh, so another question
Yes.
again has come up. Is it recommendable to get patients with osteoporosis into swimming as an aerobic exercise? So asking whether
Yeah,
it's
no, the osteoporosis normally, to if you want to increase the density of the bone, right? You have to increase the density of osteoporosis, you have the bone density less. So if you want to increase you have to give stress, right, to the bone. When you stress the bone, it will automatically the density of the bone will increase. So this is one of the very good the aerobic exercise, right? But the stress is there, but less than when you do the exercise in the ground, on the land, right? So here also we have some stress, but some form of stress, but there the stress is more when you exercise in the ground or land when you do land exercises. So, but it can be recommended if the patient can do only swimming, it's okay, no problem. They can do, no issues. So, but swimming is a very good example for aerobic exercise and full body workout.
thank you very much, sir.
Okay.
So because of the time constraints, we'll be closing the session now.
Okay.
So again, thank you very much for Dr. Isra Jabbar for taking his value. And I'd like to also put a little reminder to our audience. Thank you again for joining and thank you for your active participation, especially asking the questions as well. Please kindly make sure that you go to the link in the chat box and you access the feedback form as well as the post assessment questionnaires. Please be kind enough to fill it the form fully and submit it so that we can give you your e-certificate for participation. Again, we'd like to thank our expert lecturer for his valuable opinions, and thank you again for our lovely audience. We were, we are hoping to see you back here again next Sunday with another valuable session and continue your participation throughout the sessions organized by the Society for Health Research and Innovation in the future as well. Thank you very much and have a good day.
Thank you very much.